This is Dr. Amanda Balser, and this is a brief video to explain the group intervention assignment that you will be doing. And you have a few weeks to complete this, but I wanted to give it to you fairly soon so you can get started. For this group intervention assignment, you will be evaluated on your ability to provide treatment interventions for a group of clients who are at risk due to their current physical health. Your group will be assigned a condition and a population that will be receiving the education and therapeutic interventions. Your presentation should be 15 minutes in length, with each group member expected to provide 5 minutes of the intervention that you've planned. You should recruit at least one individual who will be representing the population you are providing services to that is not a member of your group. And this is the person you'll be providing the interventions for. This must be an individual who is not an occupational therapy student. It may be another student, a family member, or an acquaintance, and they do not need to have the condition that you are presenting, as this is a simulated assignment. During this presentation, be sure to look at the rubric. There's a grading rubric attached in the folder for the group intervention assignment. And you should demonstrate professional appearance and behavior, and this includes wearing your EKU polo, khakis, and your name badge. Follow an orthopedic protocol or surgical precautions per the condition. Select an appropriate direct intervention that can be delivered to a group of clients with orthopedic conditions to enhance their safety, health, wellness, and performance in occupations. You will need to provide occupation-based practice, which is an orthopedic treatment intervention in a group scenario. Demonstrate the therapeutic activities that can improve occupational performance in a group setting. Demonstrate your ability to explain to the client why treatment interventions are being used and evidence to support their use. So you will need to locate an evidence-based practice article to support the intervention that you have selected. Provide handouts to the individual in the group that will be considered a home activity program. And then you're going to write a short report, including the topic, type of group selected, list of therapeutic activities selected, and justification for the selection. You will include a level of group participation and any comments made by group members and what you might change about the group orthopedic intervention next time you present. And you will need to record this demonstration. Okay. There will be some resources that you need to locate in order to prepare yourself for your presentation. Direct Chapter 4 and Direct Chapters 28, 29, and 51 will provide you with some resources depending on what your group population and orthopedic condition is. The orthopedic conditions the interventions will include rest, sleep, and stress management, home accessibility and home modifications, ergonomic workstation, symptom and condition management, pre-surgical joint classes. Sometimes you'll hear this called prehab, energy conservation, work simplification, energy optimization, and pacing, and then chronic pain management. And there is a Google Doc in the folder that has your area of intervention and then what the condition is going to be. You will need to select appropriate tasks, activities, exercises, and occupations, administer the treating intervention safely and effectively in the group setting, and be sure to ask your client for feedback and teach back so you're assuring that there's learning. And then you're going to write the short report of group participation, and this can be completed together or separately, depending on what you want to do.